people that are overweight or obese, people that aren't really that physically active, a high diet and red meat, low vitamin D, smokers, people who drink, older folks, people with a family history, and people that have had it before, someone with a gene mutation, IBD, which is also inflammatory bowel disorder, or people with type 2 diabetes. What is a colonoscopy? A colonoscopy is where they perform like an endoscopic exam of the large intestine and a small part of the small intestine, and they use it with a fiber active camera, which is pretty much, it looks like a pipe cleaner, but it's a camera, if that makes sense. It's bendy. How often should you get a colonoscopy? You should get a colonoscopy at age 50 unless you're already having stool problems like bloody or it's discolored, and then they do a checkup every 10 years. So yeah. How do you prepare for a colonoscopy? A colonoscopy, you actually need your intestines to be empty. So what you should do is you should have low fiber foods, some soups, some broths, mostly liquids is what you want to be eating. I know my parents have had sugar jello to get the calories, but what you really want to avoid is alcohol and food dye and fiber foods, so you're not gonna have a full bowel, and food dye so it doesn't dye the inside of your intestines and it doesn't look weird, because that can mess with finding it. Laxatives is what they usually have you take. They make you take 2 rounds, and as my parents have said, it makes you poop for 1 week and poop for the next week, in all one course of a day, or in a while, I don't remember. How you treat colon cancer? You can use the chemotherapy, surgery to take out the affected area if it's small enough. If the cancer has spread to the lymph nodes, usually you can do surgery if possible, but it's always followed by chemotherapy and radiation. Sorry, I can't breathe. Doing a colostomy bag mostly for comfort, to collect waste, because it's probably really hard to poop when you have cancer in your large intestine. And then for recurring cancer, they try to get in there as fast as they can and try to remove it. But yeah, so please make sure to get your colon checked. And I'm gonna be honest, all my sources, it was my childhood sources. We looked at cancer books